AST is a really good liver enzyme, but it also comes in other places, and in other places enough to kind of matter. It also comes from skeletal muscle, it also comes from heart, and it also comes from red blood cells. So inside of us, we have ALT and AST. There's a little more AST because it comes from 4 places. Okay. I think I'm going to give you my stupid mnemonic right now, because why not? So the first one here, ALT being SGPT and coming from liver cells, you need to know those 3 factoids. So if you've worked on the crosswords, you might go, I don't know how to fill that one in. Like the worst mnemonic ever. This is it. Clever. It's bad. It's really bad. Okay. But it gives you the P for SGPT. It gives you the L for ALT and the fact that it comes from liver. And it's one of the answers on the crossword. So I can live with it. I don't think it's that bad. There's another one that you can do. Please pass the liver. But nobody would ever say that. Not in my house. I don't think I can eat livers if you have a piece of bacon with each bite. That's not good for you. But that gives you the P, the L for the liver. It gives you the P for SGPT, and the fact that it's liver. Either way, however you want to do it. So AST, you can do this a couple different ways. You can do O-sick heart. That one. O-sick heart gives you the O for SGOT, it gives you the S for AST, and it gives you the heart. It just doesn't give you the other ones also. So I kind of like O-slicker heart, and even O-slicker heart doesn't get to everything. But O-slicker heart gives you the O for SGOT, gives you the S for AST, gives you the L for liver, gives you the R for red blood cells, and there's your heart. The only thing it doesn't give you is skeletal. Oh, look, the skeletal muscle could go right here. Oh, muscle. So, O-slicker heart could give it to you all. However you want to know that, however you want to memorize that, whatever works for you, I want you to know all those factoids. So ALT is called SGPT, fabulous liver test. AST used to be called SGOT, comes in 4 places: liver, skeletal muscle, red blood cells, heart blood cells. Red blood cells, heart cells. Okay, back to words. I'm back to ALT. For interferences, hemolysis is the same thing. Hemolysis just wrecks everything. Bless you. See all those drugs under there? I don't expect you to know those. What I do want you to know is the transaminases, which is both of these guys together, everything affects. If you go achoo, you're going to double your transaminases. If you have a drink of alcohol, your ALT will double itself, just like that. If you take any herbs by mouth, anything by mouth, it will make those transaminases almost always double. It's very sensitive to things that we ingest by mouth that would be considered toxic to our body. So what I'm trying to say is when these things come back and you see AST and ALT maybe double, don't get too concerned. I'm not too impressed, frankly, until they get to maybe 10 times for sure, then I'm impressed. But I'm not too impressed until maybe 4 times that level of normal, because it's so easy to double these things just by sneezing. Okay? So don't know all those test interferences. Just know things that people take by mouth are going to make their AST and ALT go up. Don't need to know normals. As far as increased values, this is a great test for acute hepatitis, acute viral hepatitis. AST is the next transaminase. We've already kind of done this one. It used to be called SGOT. It's found in liver stuff. I think people forget that it's found in the liver. It's a decent liver test for hepatitis. It's also found in the heart, like a heart attack, skeletal muscle, and red blood cells. So when AST goes up, it's going to be when those cells are hurt. When somebody hurts them for some reason. Great. Let's go all the way down to clinical significance of AST and ALT and put them together. So, if both AST and ALT are elevated as highly suggestive of liver disease, and it's highly suggestive of hepatitis. That's the liver disease. These are the enzymes when people have hepatitis. AST and ALT just go sky high. ALT is characteristically higher than ALT because ALT just comes from the liver. So both of them go up for hepatitis, but characteristically ALT goes up just a little bit more. So if we're drawing arrows, we could put 4 arrows up for ALT and 3 arrows for there's the substances again. I don't want you to memorize the list. I want you to understand the concept that all sorts of stuff that people take will cause AST and ALT to be elevated. I'm not going to do this today. Let's do some diseases. Myocardial infarct. This is the 3rd enzyme of the heart attack. First enzyme was CPK for no money but bragging rights. Do you remember which isoenzyme? CPK isoenzyme 2 for acute myocardial infarct. It's a fast enzyme. Okay. AST is a fast enzyme also. They kind of go neck and neck. AST lasts a little bit longer. And the 3rd one is LDH. Want to take an isoenzyme for a heart attack on LDH? 1, 3, or 5? 1 red heart. Okay. So for myocardial infarct, back to this. AST is the transaminase that's going to be elevated. It's just like any enzyme. How high it gets is roughly proportional to how much tissue has been damaged. Viral hepatitis, these guys this is where they shine. You can see a good case of hepatitis. The normal range is something like 0 to 50, right around there. You can see levels of 3,000, 4,000, something like that. So when you have viral hepatitis, these guys go sky high. Which one's going to go higher, ALT or AST?
ALT.
ALT, is that what you said? Yeah, ALT, because it's more liver specific. Progressive muscular dystrophy, we've got better enzyme. CPK is a much better enzyme. You want to take a shot at that? 1, 2, 3 for isoenzymes?
3.
Yep, isoenzyme 3. So CPK would be a better test, but AST is also found in skeletal muscle. So AST would be elevated when you hurt skeletal muscle. However you want to hurt it, AST is going to go up. And then there's like some others. So infectious mononucleosis, the reason it goes up is because of the hepatitis that's associated with infectious mono. So a lot of people, like 50% or so, of persons with infectious mono are going to have hepatitis, just an inflamed liver. Cirrhosis kind of depends. Cirrhosis, the liver is more scar-like, and so if your transaminases go up, they're not going to go up very high, maybe 2 to 3 times, something like that. Cholestasis, they will go up, but not very high. Cholestasis, again, GGT, alkaline phosphatase, way better enzymes. These would just go up a tiny bit, maybe double or so. That's it for that. Let's talk about enzymes and disease. First one is a heart attack. Now, you guys know, I have a pretty strong family history of coronary heart disease. So if I clutch my chest, what are you going to do for me? I think for that. And as someone is dialing 911, what's the other thing you're going to do for me? Yes, you're going to give me your aspirin. Do a dog thing. Make sure I swallow it. So while they're coming, if you got an aspirin, that will help. Okay. So let's talk about heart attacks. Most of the time, it's precordial pain. Let's do TD heart attacks. TD heart attacks are like the heart attacks that men get. Okay. They clutch their chest. That's precordial pain. It's very bad, and they're going to tell you it's very bad. If they have angina, it's worse than their angina. It's crushing. They often use big words. They'll say, I feel like there's a ton of elephants on my chest. I feel like there's a wall that fell on my chest. They're making eye contact with you. It's really bad. Sometimes they say it's like a bursting chest pain, like the chest is exploding. They want you to know how bad this pain is. Again, if it's a TB heart attack, it radiates almost always to the left arm, more than 90% to the left arm. Every once in a while, you'll get it radiate down to the right arm. So Those are just guy heart attacks. Women are way different. Most of the time when it radiates all the way down to the fingertips. Okay? And then we're going, sounds like a heart attack. Diaphoresis means profuse sweating. So they're just sitting and they'll break out into a sweat. So, by the way, if you have chest pain and you go to the hospital, you get to go to the front of the line because it's a big deal. It's what's called the golden hour. They have an hour. If you can survive the first hour, there's a good chance you're going to survive the whole nightmare here. So diaphoresis is profuse sweating. All patients who are having a heart attack have a sense of impending doom. They might not say, I have a sense of impending doom. What they usually say is, I feel something really bad is happening to me. They really want you to know that something bad is happening. People need to listen for it. Women, when they're having a heart attack, they have different symptoms because they have smaller vessels. Their heart is smaller than a man. They have smaller vessels and they have different symptoms. Whom do you think gets to live after a heart attack more often, men or women? Men. Because women, they keep missing it. It's misdiagnosed because they have little hearts, little vessels, and they don't get TB heart attacks. It's pretty hard to miss a TB heart attack. They clutch their chest, fist sign. They clutch their chest. They tell you it hurts. They tell you it's bad. They tell you they think they're going to die. They're sweating. They say it goes down here. You'd be hard pressed to miss that as an acute myocardial infarct. Women have different symptoms. Women typically have shortness of breath. They'll just say, just can't catch my breath. And they'll have unusual fatigue with regular exercise. So they'll say, you know, I used to be able to walk for a mile. I can't hardly walk to the end of the driveway. I'm just exhausted. I don't know what it is. They don't get so much chest pain as a heaviness in their chest. If they get radiation, it's to both shoulders. They'll say, you know, my shoulders hurt. I have some upper abdominal, my thoracics hurt a little bit uncomfortable like that. And that's their heart attack. And it's really easy to miss that because it's easy to blow it off as, you know, you're probably carrying some stress in through here. Let's do some work on your CT junction, that kind of stuff. They're tricky. Women are tricky when they have their heart attacks. You have to be like on your game there. As far as lab findings, so EKG is good to do. It's not 100% diagnostic, maybe somewhere between 50 and 75% diagnostic. They're really good at showing old heart attacks, and not so good at showing current heart attacks. Troponin is a great test for a heart attack. Some places still do enzymes, which is why I still teach about it, because enzymes can tell you the pattern. They come out, they peak, and they go away. Don't want you to know time. I want you to know that CPK comes out fast, AST comes out fast, they peak fast, they're back down to normal. LDH takes a long time to get to where it's going. Okay? I think that's enough to say about the heart attack. Oh, that's just CPK. AST and LDH would also come out like that. Sub rate goes up, as you would think, and the white count gets really high, really fast. And did I ever draw this picture before? That's a blood vessel. Is it familiar yet? Okay. So, you'll say, how can you get a white count go up just like that? Because inside of our bloodstream, these are our white blood cells floating along having fun. We stick a needle into somebody, we measure those. And it's called the circulating granulocytic pool. That's our normal white count. On our vessel walls are some white cells that are just hanging. Just hanging. Not doing anything, but just hanging. And that's called the marginated granulocytic pool. Their claim to fame is if we need them and we don't have the 7 to 12 days it takes to make a white blood cell from the bone marrow to get to the bloodstream, they go, can do. And they jump right in. And they become part of the circulating granulocytic pool, and that's how you can go from 7,000 to 20,000 just like that for a white count. Pretty clever idea that the body has, right? So that's that, heart attack. Next is liver disease. So liver disease can really break it into two gigantic categories. Cholestasis or hepatitis. So this is probably a good place to write in our little thing. So, when cholestasis, you guys have already said this, GGT, and alkaline phosphatase are the enzymes of choice. And they parallel each other. So if we were to use pluses or arrows, we would say something like GGT, alkaline phosphatase are 4 plus, or 4 arrows up, or something like that. AST, ALT, not such good enzymes for cholestasis. They'll go up, but they won't go up very high. So we can say, maybe it'll be something like that, okay? And LDH always wants to hang over here. For hepatitis, GGT, alkaline phosphatase, not so important. They're still going to parallel each other. We'll give them like maybe 1 to 2 arrows up. Yeah, when we look at our transaminases, AST and ALT will go sky high. You, when you do your quiz, want me to know that you know that ALT is characteristically higher than AST. So give ALT 4 arrows, 4 plus signs, or something like that, and AST give it 3. That's kind of enzymes in liver disease in a nutshell. And we'll talk about liver stuff when we do a liver function test after the midterm. Maybe tomorrow, we'll see. That's everything. That's everything for liver disease. Acute pancreatitis. Acute pancreatitis, most common cause is alcohol abuse. You can also get trauma, like a car accident, you get a steering wheel right into your pancreas. So it's severe upper abdominal pain, radiates straight through the back. Patients will feel better if they flex forward. If they have this and they come into your office, they'll come in bent over like this because it feels good. And if you say, go ahead and stand up, they're going to say, I'm not going to bend forward because it really helps with it. Acute pancreatitis is super painful, very painful. Usually they're going to have probably a low-grade fever, 100, 101, something like that. Nausea and vomiting because of the pain. It's just severe pain. As far as the enzymes go, amylase and lipase are the ones for pancreatitis. You can choose whichever one feels nicer for you. Some docs do both of them. They both have pluses and minuses. Sensitivity and specificity. I don't care. When I say pancreatitis, I want you to say amylase and lipase. Okay? That's for true abdomen. Prostate cancer is the next one. Prostate cancer. It's the majority of malignancies in men over the age of 95 or 65. Like I mentioned before, 90% of 90-year-old men have prostate cancer. It works differently in an older man. It's a much slower progression of the disease. So first off, there's no symptoms. That's why we want to screen for it with a PSA and a digital rectal exam. When they get symptoms, they'll get symptoms of bladder outlet obstruction. That's things like hesitancy in starting the stream or terminal dribbling. It's often, I think, difficult wasn't the word I wanted. I'll just say hard, maybe for some male patients, they often it up to some clinicians, that they're having trouble starting their stream, hesitancy, or terminal dribbling. So if you're wondering about it, you might actually specifically have to ask those type of questions, like, have you noticed that you're having trouble starting your stream? That's bladder outlet symptoms. Obstruction to the ureters is a little bit later. Hematuria is way later. The claim to fame for hematuria is it's painless. And so they can have bright red blood that they are bleeding or urinating. And it looks like they threw some blood into the toilet, and they'll say it's perfectly painless. There's no burning, anything like that. That's really typical of prostate cancer. You don't want that one to go away from you. When they get mets to bone, obviously they'll have symptoms of bone. Usually the pelvic bone pain is deep. Usually patients call it boring pain. Can't get comfortable. They can't find a comfortable place to sleep. Night pain, stuff like that is typical of bone pain. Very painful bone pain. Lab-wise, painless hematuria. Pyuria is an increase in white blood cells in the urine. Acid phosphatase, alkaline phosphatase aren't the best enzymes in the world. They have, with acid phosphatase, it has this sort of 80-20 deal. So with local prostate cancer, 20% of them have an increase in acid phosphatase, and 80% of them it would be normal. Not a very good test. It's really not very sensitive at all. Okay? When the prostate cancer is metastatic, the numbers just flip on themselves. So 80% will have an increase in acid phosphatase, 20% will be normal. So it's still not a really great test, because even with METs, 20% of them would have a normal acid phosphatase. Alkaline phosphatase will go up if it's gone metastatic to bone. So if I ask you a question, prostate cancer with METs to bone, I'm wanting acid phosphatase and alkaline phosphatase. Okay. Malignancy. So with malignancy, the Reagan isoenzyme is 1. 50% of persons with LDH, isoenzyme 3, is another one for non-specific malignancy. Hematopoietic disease, LDH isoenzyme 1, because it's found in red blood cells. And for muscle disease, CPK is the best. Which isoenzyme would it be? 1, 2, 3?
3.
And what other enzyme for muscle goals from today?
LDH. For the
LDH and AST. I mean, sorry, AST. AST and LDH. And it would be LDH isoenzyme
5 skeletal muscles.
5. Then you just have to put that all together. So, a couple things. Yeah, easy peasy. Couple things for the quiz. So I have a study aid, just a blank chart. And what it does is it's got, I believe, the enzymes go this way and the diseases go this way. You can choose to fill it in or not. So for example, let's say the first one is alkaline phosphatase. Alkaline phosphatase. It's found in liver disease. Yes, liver bone. Is it found in bone disease?
Yes.
Yes. Is it found in cholestasis?
Slightly.
Yes. Is it found in hepatitis? Little yes. Is it found in the heart? No, right there. Is it found in skeletal muscles? No, nothing in there. Is it found in malignancy? Yes. Reagan isoenzyme fits right there. That's how that chart works. If you don't want to fill it out, you don't have to. And then there's probably a little place for notes or not, if you want to put notes in. There's a crossword puzzle. Now you should be able to figure it out because it gave you the answer. Done? Questions? Go enjoy a beautiful third to the last beautiful day.
Rain and snow, 30.
See you guys tomorrow.
Yes, I like to see. Makes me happy.